What it do, cyber world? It is your girl, the one and only, Ash Brown, and this is the Ash Said It Show. Over 2,100 episodes since 2014, 500,000 streams all around the world. None of this is possible without you guys, so I thank you so very much. Today, my esteemed guest is a very renowned woman, okay? We're talking today to Dr. Pamela Roshell. She is one of the highest regarded experts on health services in the South and an Obama administration presidential appointee. Hello, Dr. Roshell. How are you?
Hello, Ash. I am amazing today.
Yes. Oh, blessed and highly favored. I love it. I love it. Now, Dr. Roshell, as a former Obama administration appointee and regional director for HHS, you have a deep understanding of federal programs. So, how does that experience inform your current work in Fulton County?
Well, first of all, thank you for having me today. I am super excited to have this conversation. I have been passionate about healthcare and health equity for many years, and that's what my career is built around. So thank you again. Your question. So as a presidential appointee from 2012 through 2017, there were so many learnings, so many insights and lessons learned, and how that has really translated at the local level in a county government structure is the deep understanding about how policy drives decisions and how to keep your eyes on that policy, not only on the federal level, but it helps to frame what we do and what we target on the state level as well. And so if you thought about a pyramid, so to speak, and you think about federal policy and then state policy, it allows our commissioners at the very local level to also craft policy that's in alignment, that puts us in position for resources, financially, partnerships, and just really doing the best job that we can in a very collaborative fashion. So that understanding has really served me well, and it's really served the county well from a strategic planning and policy and resource allocation perspective.
Indeed. And Fulton County is a very large and diverse county, stretching from Milton to Chattahoochee Hills. How do you tailor the health services and resources to address those unique needs of the communities?
Yes, that is a great question. The number one component or element of that is data. Really using a data-driven approach to frame how we implement programs and services and decide what we need to do. The other piece of that would be citizen input. Because we're at a county level, we have so many opportunities to engage with constituents, to hear what they have to say, to really understand what their needs are. And so that would be the second element, would be community input. The third, I would say, is looking at partners, people who are already in those communities doing great work, and being very careful not to duplicate, but to enhance and expand what's being offered and fill in the gaps. And then the final piece of this is really working within a framework. And so in the county, the framework that we use is a health equity framework, and it's really the foundation of how we think about approaching health equity and the social determinants of health. So those would be the four elements that really drive how we determine the unique needs of the 1 million plus constituents in our county.
Yes, that is incredible. And as we were speaking before, I'm also a Georgia resident. Been traveling a little bit here and there, but Fulton County is definitely a pivotal county of the metro area. So that is really awesome that you have really decided to really hone in on the needs of the community in that fashion. So I tip my hat to you all. Absolutely.
Thank you.
Yes. Now, the concept of health deserts is a critical issue. All right. And
yeah.
Can we describe the strategy or perhaps the process behind developing these new clinics and what specific services they're going to prioritize?
Yes, and so building off of the last question, I spearheaded a study in 2023 to really look at what the healthcare needs were in the community using that data-driven approach, looking at existing research, looking at health data, having conversations with communities and providers alike to help us better understand how we could address, in some areas, very long-standing health equity and healthcare gaps. And so out of that research, we were able to develop a 5-part strategy that, based on that data and that community input, we were able to see what areas in the community had little to no clinics or access points for health care. What areas in the community, based on insurance coverage, which is an access issue, disproportionate impact. What areas of the community carried more of the healthcare burden? And so when we looked at fewer no healthcare providers, limited facilities, barriers to access, and disproportionate impact, it helped us understand where we needed to put, for example, our new behavioral health crisis center. Stood up the first behavioral health crisis center in Fulton County, and the importance of a behavioral health crisis center, especially in these times, is an access point for crisis mental health care for constituents with little or no health insurance. So that data helped us develop that. The data also helped us understand that many seniors, for example, don't take advantage of a Medicare benefit that is an annual wellness visit that helps them plan, that helps them understand their health care status. And so we placed mobile clinics throughout the community. So those are some examples of how we use the data and examples of partnerships with Grady Hospital, a longstanding partner, working with them to understand where we needed to add primary care access points in the community, as well as a partnership with Morehouse School of Medicine to reopen a clinic in East Point to, again, provide an access point and more access points for individuals.
Yes, that's a beautiful thing. Wow. That is really an awesome way for you all to address those issues. And given your background at AARP, how are you specifically addressing the health and wellness needs of Fulton County seniors, in addition to, what you just talked about?
Yes.
But in terms of social engagement.
That is such a great question. And I know with the thousands of podcasts that you've had over the years, seniors is often a topic. Yeah. You are hearing more and more about boomers and the aging population. And so services are important. These are older adults who have served our community, have had wonderful careers across their lifespan. And so the county is certainly committed to providing resources and services for seniors. And one of the unique offerings that we have are our multipurpose facilities that offer wonderfully prepared meals, engaging classes, swim classes, exercise. If you go in there and see some of them doing boots on the ground and the latest shuffle and slide, I tell you, it is so wonderful to see them keeping their mind and body and their nutrition up because we're offering those types of services. So that's just one example of the way that we continue to keep seniors engaged through just a network of services that we offer for seniors from when they're very active and as they start to get more frail.
Yeah.
At the end of that continuum, we also have adult day health services.
Awesome. Yeah, I think that you're absolutely correct. Like, I think sometimes people will glaze over the issues that some seniors will go through in that later stage in life, and how important it is for engagement, and like you said, them dancing the boots on the ground and whatever else might be, trending, and, getting them up and moving and, getting them feeling good about themselves and in their situation and in their stage of life, giving what their mobility issues may or may not be. I think it's so important. It's super big.
It's critical, and there's so much research out there that points to the importance of staying active and engaged, to have this sense of belonging in your community. It just helps the mind, the body, and the soul to remain active and engaged and in the best health possible.
Yes. And I want to go back to, as you were speaking earlier about Morehouse, the School of Medicine, and that partnership. So I want to talk about that partnership, and as far as going into, opening of that new clinic to address the healthcare desert in South Fulton. What makes a partnership like this so vital, and what role do they play in creating these equitable healthcare systems in the county?
So what we look for in any partnership is a common mission and understanding and commitment of what we're trying to accomplish. And so Morehouse School of Medicine is a world-renowned healthcare training. Some of the best doctors in the world have been trained there, but they never lost sight of a commitment to the community and wanting to ensure that they not only train the best, but they then provide access points for that service. So it was just an amazing opportunity to partner with an organization that's so committed to community access to care. And so we talked over several months. They were a critical component of the Project Care study that I spoke about and have just been an amazing partner. So we were fortunate that we were really wanting to accomplish the same thing.
Awesome. And, of course, your role involves a broad portfolio, including public safety and arts, in addition to health. How do these different areas intersect? And how does a holistic approach to these services improve the overall well-being of people?
So when you think about healthcare, and again, using that social determinants of health model, our lives, and when you think about health in general, there are components that are included in that aren't just about seeing your physician. It also matters where you live. It also matters where you work. It also matters where you have access points for education. And so many of the programs and services and departments in my portfolio touch on aspects of social determinants of health, which allows us to leverage internally resources. It allows us to collaborate internally to really get to where constituents need help, not just in healthcare. But, for example, if you don't have decent housing, you're not going to necessarily prioritize going to a routine physical. If you don't have proper nutrition, the same concept. Your life is a total circle and a compilation of many things. And so in order for you to prioritize health, in most cases, you need to have the other aspects of your life in good order as well. And so that is one advantage of the portfolio that I have, is that a program in my community development department that provides down payment assistance or rehab for a senior's home can collaborate with senior services or can collaborate with the library to provide education about these programs. So it's really an amazing opportunity for internal collaboration and ultimately impact.
Yes. Now, Dr. Roshell, if people want to get in contact with you or your team and they've got questions about anything that we discussed today, what is the best way for them to reach out?
So the best way to reach us would be at 404-613-6000. 404-613-6000.
Okay. And we will put all that information in the description of this show. Dr. Roshell, thank you so much for coming through. We so appreciate you. Sprinkle, sprinkle.
Thank you so much for the invitation.
And I know that there's going to be new announcements and other things going on with the county as the year goes on. As I can't even believe, we're talking about 2026 just around the corner.
I know. Can you believe that?
Goodness. But I would love for you to come back and share with us. We love getting this information out to the community and out to all of our wonderful listeners. Loving that.
Well, yes, we are looking forward to those calls and continuing to be of service.
Definitely. And I appreciate each and every one of you guys. Thank you so much for your love and support. Keeping in mind, anyone to tell you that you can't do what you want to do, you look them square in the face. You tell them, don't believe me, just watch. Watch what I do. Watch me make it happen. Watch me make history. That's what we're doing this for, the history books. Social media is nice, but real life is so much better. Until next time, you guys.